The college has recently started a program called the Multidisciplinary Design Minor. Within that minor, students can specialize in a specific area. And so we will be launching something called the Global Health Specialization in the fall. And the hope is to have students actually experience co-creation, medical solution in both the domestic and international environment, and then design products for these communities, then go back and introduce what they've designed to the communities and get feedback and develop a second version.
It emphasizes avoidance of the hit and run. Coming into a community as a member of a student organization, working on a project over a very short period of time, and then leaving. This is extremely disruptive to the community.
This summer I was in Ghana for 3 months as part of the Raoul Wallenberg Fellowship, and for the first month I was overseeing the distribution of a container of medical supplies from an organization called United to Heal. And the second 2 months I was evaluating the portable gynecology examination table that was developed as part of the new Global Health Design Specialization.
I started a special section of the capstone senior design course in mechanical engineering. The theme of the section was Global Health Design, targeted for Africa. Joey was a member of a 4-person team that was working on a portable obstetrics and gynecology examination table for use by the rural healthcare workers in Ghana. It could be folded up and worn in a backpack on a motorbike carried by the community healthcare worker.
Many times women have to travel 5-6 hours from their village to even get to a district hospital. So the table was developed so that the midwives and healthcare workers that are living in the villages could perform the pelvic exams out in the villages themselves. I spent the first week at the actual district hospital, showing all the midwives and the healthcare staff there at the table, getting their thoughts on it, doing different testing with them, setting it up, and the acceptance and the culture at the actual hospital setting. And then for the other 2 weeks, I was out in 2 different villages. When we got there, we would meet with the chief of whatever small village it was, talk to him, get his permission to come into the village. And then we would meet with some of the traditional birth attendants there and talk to them about what the issues are.
In order to develop a product that will be meaningful for the end user that you're designing it for, you need to involve that end user throughout the entire design process. Otherwise, the likelihood of designing something that would be appropriate for that particular end user or for the particular region that they're designing for is unlikely.
When I'm talking to different people that are in engineering in general, when I was in Ghana, the fact that they could develop a new technology didn't even register. And I feel that the potential is so great for that to happen. So long term, to really develop those ideas and start to work with the engineers there, that they're the ones in the culture, they're the ones in the community, they know best. And for them to really be working, collaborating on it, and start to develop some of those devices along with the economic impact it could have is something that I just get really excited about.